Good day, everyone. Welcome back. In this session, we will continue our discussion on the introduction to telehealth practice for prime care nursing practice. In our previous video, we discussed what telehealth is, and we said that telehealth is the delivery of healthcare services and clinical support through digital communication technologies when the patient and clinician are not physically co-located. We also noted that telehealth is not just about technology. It is still clinical care, and the clinician remains responsible for safe decision-making throughout the encounter. In addition, we explained that telehealth is the umbrella term, while telemedicine is the clinical part of it. Finally, we highlighted that telehealth has developed over time as health systems looked for ways to improve access to care, especially for people in remote or underserved areas. By the end of this session, you will be able to 1. Explain the roles and responsibilities of nurses and midwives in telehealth practice. Describe the benefits of telehealth in clinical care. Identify the limitations of telehealth in clinical care, and recognize patient safety risks unique to telehealth. So let's begin with, what are the roles and responsibilities of nurses and midwives in telehealth practice? In telehealth, nurses and midwives often serve as the first clinical point of contact because physical examination is limited. Nurses and midwives must rely more on careful questioning, listening, observation, and sound clinical judgment. Their responsibilities may include triage, history taking, patient education, symptom monitoring, identifying red flags, deciding when escalation is needed, documentation, and referral and follow-up coordination. Next thing we are going to focus on is, what are the benefits of telehealth in clinical care? Telehealth offers several important benefits. These include improved access to care, reduced travel time and cost, faster contact with a clinician, continuity of care, easier follow-up, support for people in rural underserved areas, and better access for people with mobility or distance challenges. Note: telehealth can be especially useful when the patient's condition can be reasonably assessed without face-to-face examination. Next thing we will look at is the limitations of telehealth in clinical care. Telehealth also has important limitations. These include no direct physical examination, incomplete sensory information, dependence on patient-reported symptoms, poor network or device quality, reduced ability to assess subtle physical signs, and difficulty recognizing deterioration in some cases. Note: these limits mean that telehealth is not suitable for every patient or every condition. And finally, let's move on to what patient safety risks are unique to telehealth. Telehealth has special risks because the clinician is making decisions with less direct clinical information. The important risks include missing serious symptoms, delayed escalation, false reassurance, misunderstanding the patient's description, poor assessment due to incomplete data, overestimating what can be safely handled virtually, and lastly is failure to recognize when in-person care is needed. In summary, we learned that in roles and responsibilities in telehealth, nurses and midwives are often the first point of contact and must rely on careful questioning, listening, observation, and clinical judgment. They are responsible for triage, history taking, patient education, symptom monitoring, identifying red flags, escalation, documentation, referral, and follow-up. That is it for this session. Thank you for watching. See you in the next session.